Our next patient is Jill. She has both migraine headaches and sinusitis masquerading as migraine, and both respond to a triptan. Jill, how long have you had migraine headaches for?
About 25 years.
So what age were you when you had your first headache? Do you remember that?
About 18.
You know when a headache's coming on?
Yes, I know when a headache's coming on. I typically feel real yucky, and about 10 minutes after that I get a very painful throbbing.
How often do you get these headaches?
Now, with medication, once to twice a month. Before that, I was getting them 5 to 6 times a month.
When you have a headache, where's the pain located?
Behind my right ear, always in the same spot. Occasionally it'll be over here on the left, but typically on the right.
Now, does the pain go anywhere? Does it move around your head?
No, it pretty much stays there.
Okay. Now, do you have pain anywhere else in your head?
Well, resulting pain from that, it starts throbbing everywhere.
Where's the next part of the head that you may have throbbing?
Just everywhere.
Everywhere. But it always begins behind the right ear.
Mm-hmm.
Do you have any pain involving the right side of the face?
When I think I have a sinus infection, I do notice pain in through here and then down my neck as well.
What medicines have you tried in the past?
I've tried Stadol, Fiorinol, Butybidol, ergotamins, Tylenol with codeine, Fiorinol with codeine, probably another 10 or 15 over the course of the 25 years.
Now, these are pain medications. Have they helped your headaches over the years?
They dulled the pain. They don't do much for getting rid of.
The pain never is 100% relieved.
No.
From these medications. Now, do you have members of the family who have migraine headaches?
No, none.
You have any kids with headaches?
Not yet.
Okay. When you get a headache, with 5 being the worst, 1 being the best, how would you describe or how would you rate the pain?
Without medication, definitely a 5.
Is the pain excruciating?
Excruciating.
How else would you describe it? Can you describe it any other way?
Several times it's gotten to the point where I've vomited, which I know it's a really, really bad headache if I'm feeling that way.
Have you had any neurodiagnostic studies, like scans, done in the past?
In 1998, I had an MRI of the brain.
And was that normal?
Yes.
How do these headaches impact on your daily living and how you work?
Well, because I'm a single mother, I can't let them. But occasionally they do impact. I have to lay down in bed and my children have to take care of me and rub my neck and make sure I don't take too much medication and cook their meals for themselves.
Now, would you consider these disabling headaches then?
Oftentimes, yes.
What medicine are you taking right now?
Zomatriptan.
Zomatriptan. When you take zomatriptan, does the pain usually go away?
Yes, in about 10 to 15 minutes. Occasionally I'll have to take a second dose.
Okay, now you recently have had pain around the face, and I understand you saw your family doctor who thought you had sinusitis.
Yes.
Now, I gave you some zomatriptan. How did you respond to the zomatriptan?
Well, I took it that day because the pain from what I thought was a sinus infection was feeling like a migraine, so I took a tablet and it went away within about 30 minutes.
Did it come back?
No.
Before you came to see me, you were seeing your family doctor. He was treating you for sinus headaches. What medications did he try you on?
Antihistamines and pain medication as well, Tylenol, over the counter.
Would these medications help the headaches?
Well, they help relieve some of the nasal congestion, but the pain was always still there.
And now that you've tried the zomatriptan?
I'll try it every time.
Because?
It relieved the pain immediately.
So some of your headaches that had been diagnosed as sinus headaches in the past have now been relieved by zomatriptan?
Yes, they have.